Hello, I'm Hannah Donnett with the Collaborative on Health and the Environment. Che enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's Che Partnership webinar, which is titled Health Effects of Wildfires, How to Protect Yourself and Your Family. Our moderator today is Maria Valenti, Director of Commonwealth's Health and Environmental Literacy Project. We will leave time following the presentation for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speakers to respond to. We'll get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 60 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Maria.
Thanks, Hannah. Greetings, everyone, and thanks for being with us today. I'm going to provide a very brief introduction to A Story of Health and then introduce our two speakers. A Story of Health is an online multimedia ebook, now with 6 chapters, on how the environment influences health across the lifespan. All the stories have been written by health experts and peer-reviewed. Our newest chapter, Sofia's story, is on the health effects of wildfires, which we will focus on today. The other 5 chapters explore the lives of fictional characters with diseases and health conditions, including asthma, developmental disabilities, childhood leukemia, infertility and reproductive health, and cognitive decline. This chapter departs from that format because it focuses on the health effect of exposures to wildfires and wildfire smoke instead of a particular disease. It is similar in that it follows a storyline to engage the reader and uses colorful infographics, videos, and articles by experts to illustrate the topic. It's written for healthcare providers, health advocates, policymakers, and others concerned about environmental influences on health. And the stories include links to additional resources and scientific references on every page. Although our characters are fictional, the risk factors they face are real, and Sofia's story is no exception. This story, like the others, emphasizes prevention strategies throughout. All of the prior Story of Health chapters have been awarded continuing education or CE credits by the Centers for Disease Control and Prevention, or CDC, with over 16,000 registrations to date by a range of healthcare professionals. CEs for this story have just been approved, I'm happy to say. A Story of Health has been developed in an unusual collaboration among the Federal Agency for Toxic Substances and Disease Registry, Commonweal and the Collaborative Health on the Environment, the Office of Environmental Health Hazard Assessment at Cal EPA, the Science and Environmental Health Network, and the Western States Pediatric Environmental Health Specialty Unit, or the WSPEHSU. All the chapters can be downloaded for free from the PEHSU and CHE websites with connections to the CDC CE website, and the CEs are also free. And with that background, I'll turn to the speakers. Dr. Stephanie Holm and Mark Miller will provide a tandem presentation on the key health issues we cover in Sofia's story. They are co-directors of the Western States PEHSU and are both national experts on pediatric environmental medicine. Their more detailed bios are on the website, but I'll give a little bit for each of them. Dr. Miller is also the director of the Children's Environmental Health Center at Cal EPA. He received his medical degree and completed a pediatric residency at Michigan State University, a preventive medicine residency with California Department of Public Health, and received his MPH in Environmental Health Sciences from the University of California, Berkeley. Dr. Miller is a member of the original development team and a primary author of all of the Story of Health chapters. Dr. Holm is board certified in both pediatrics and occupational and environmental medicine, and has a master's and PhD in epidemiology from UC Berkeley. She is a national expert on the health effects of wildfire smoke and sits on a National Academy of Sciences Advisory Committee on the topic. She is a medical officer at the Children's Environmental Health Center at Cal EPA. So now I'll turn it over to the speakers, and just provide a reminder that we'll be conducting a Q&A after the presentation. So please send us your questions in the Q&A chat box. Thank you. Off to you, Stephanie.
All right, thank you for that intro, Maria. So as Maria said, we're really going to be doing two things for you during this presentation. We're going to be talking specifically about what the health impacts of wildfires are for kids and how to mitigate those, and also giving you an orientation to this story of health chapter, so that if you are hungry for more information after hearing this, you know where you can turn, or if you have colleagues that you think would be interested in this material, you can point them to the story as well. This is our title slide. You can see on the right the overall sort of family reunion picture that accompanies all of our story of health chapters with multiple of our characters pictured. And down in the lower right, you can see an inset of Sofia, the main character in this story. Really quick before we dig into the rest of our material, just to say that Mark and I are both fortunate to be funded by and employed by multiple organizations, and our comments are our own and not official stances or official representations of any of our various organizations that fund and or employ us. All right. So this is how our story opens up. As Maria said, all of these stories are fictional stories of a character that lives through real kinds of exposures. This story is the story of Sofia, a 9-year-old girl, and her family, and sort of how they make decisions in the setting of a wildfire event, both in terms of sports and school. They have a family member that evacuates. And so we sort of walk through this whole story with them and interweave the science throughout the narrative, so that you can, as you're going through this story and connecting to the characters, you have the scientific information to back up all of the decisions that are being made. So as an example, in most of our pages on the left will be part of the narrative story. On the right will be some imagery, and then often either sort of, as you can see here in this green bar, or in the middle, there will be what we call pop-ups that have a lot of the scientific information. And so you can click on these little plus signs and these will pop up some of the information. So we'll start by talking a bit about what makes up wildfire smoke, and we're going to look at this envisioning particulate matter pop-up. If you were to click on that in the story, it would pop up, whoops, sorry, I am having issues with my slides advancing. It would pop up this pop-up on the far right, which shows this image of what particulate matter looks like. So the reason that we have that image is that a large proportion of what is made up of, pardon me, I am tripping over my words today. A large proportion of what makes up wildfire smoke is particulate matter. We both know that that's a large component, and it's also very well studied. And so we know a lot about particles, both during the setting of wildfire smoke and outside wildfire smoke times. Particulate matter is a bit different than a lot of other kinds of air pollutants. So, things like ozone or nitrogen dioxide have a specific chemical structure, right? We could draw that down and know exactly what that looks like. Particles are different. Particles are just grouped by size. And so that's what this image on the right is showing you relative to the size of a single strand of human hair. These are what we're looking at in terms of PM10, that's particles that are 10 microns in diameter and smaller, and PM2.5, particles that are 2.5 microns in diameter and smaller. So these are really small, and they can be inhaled deep into the lung and have both local effects there, and then by inducing inflammation, have effects that go throughout the body. Smoke, though, is actually a pretty heterogeneous mixture of things. There are a number of different components. There's some toxic gases, there are heavy metals. One of the things that makes it really tough is that the composition of smoke can actually vary based on, exactly where you are, how far you are from the fire, what the climatic conditions are nearby that have interacted with those things. So there are a number of different things that can make up smoke and be a part of it, but the majority of it is particulate matter, and that's the best understood portion as well. Also, just a note here, we have a pop-up about this in the story, that you should not rely on odor or visibility to assess exposure. Particles themselves don't have an odor. And so, the smoky odor that you can sometimes pick up is usually due to volatile organic compounds. Sorry. While particles can affect visibility, I actually have a nice series of images I took last year during one of the wildfire smoke events, showing the change in visibility from my house. There are also other things that can interfere with that, right? here in the Bay Area where I live, it can be very foggy. And so the fog can also reduce visibility. And so you really don't want to be relying on those things. You want to make sure that you're looking to other sources to assess the smoke exposure. And we'll get into that in a minute. I'll let Mark jump in now, though, to tell you about climate change.
Yeah, so on the following slides, Sofia talks to her father about what she's learning in school about climate change and says, did you know that climate change makes wildfires bigger? And her friend says, yeah, and maybe that's why we've missed so much soccer in the last couple of years. So, there are a number of factors related to climate change that contribute: the drought, high temperatures, low humidity, and high winds, the vegetation issues, and increases in lightning strikes associated with climate change. One thing that in reviewing this literature struck me is that the drought is lengthened, which lengthens the fire season. So we typically on the West Coast we have no rain during the summer and early fall, but that's increasing further into the fall, which not only has the impact of drier fuels, but also greater winds. In the fall, we have winds, and the winds are being exacerbated by the increased temperature, the ocean waters. And another thing is this map that we pulled up, which is indicating the increase in very large wildfires in the US, with the darker colors being associated with greater increases, comparing, around the end of the last century with the middle period of the century that we're in now. And what struck me was that in some of the northern mountain states and into North and South Dakota, and then this area in northern Minnesota, Wisconsin, and Michigan, that's where we see some of the greatest increases of wildfires predicted, in the next 20, 30 years. And it was surprising to me when I pulled this up last year, but then of course we saw this summer huge wildfires in the border, international boundaries water area of northern Minnesota and into Canada. So predictions are coming true at rapid rate. Next slide. So this slide illustrates a few things. One, there are those pop-ups in the middle. One, identifying pregnancy as a vulnerable period, and another pre-existing health conditions like COPD that put adults at increased risk. Pregnancy is naturally increased risk, just as children, for some of the same physiologic reasons. And data, though epidemiologic studies are just accumulating now, it does support that smaller babies and earlier births are a problem. And then if you clicked on the bottom little plus sign, you will pull up the next slide. We'll show that, yeah. And this speaks to the fact that wildfires are falling disproportionately on already at-risk communities. So for example, some work looking at socioeconomic status shows that low SES counties have increased risk of asthma and congestive heart failure visits to the same wildfire smoke, relative to areas that are wealthier. And we do point out that it's important that any public recommendations consider both the ethical and equity issues involved. For example, if we're going to provide guidance that speaks to the need for use of face masks, HEPA filters, filtration in air conditioning, housing settings, et cetera, that we need to be cognizant of issues around availability, cost, and distribution of these. Next slide.
All right, so when back to me. So when I left off a minute ago, I left you with the thought that, we don't want to rely on visibility or odor to assess exposure to smoke. And so having talked a bit about that wildfire events are increasing in size for sure, and, some of the effects of those with Mark, we now on this page go into how do you actually know if your air quality is bad, and what are some of the sources you can look at. So many of you may already be familiar with the air quality index. This is a color-coded scale that the EPA uses for reporting and forecasting daily air quality. There are different AQIs based on different pollutants. The one relevant for most relevant for wildfire smoke is the PM 2.5 AQI. And so you can see on the right here, we have in this pop-up that exists on this page, the table and color coding to show you the different scales within the AQI. And we also explain in the text that this is actually based on the EPA's assessments of health effects related to particulate matter, that the way these AQIs are calculated is to peg the EPA standard level to 100, so between the moderate and unhealthy for sensitive groups. So there's a lot of science that goes into that, and a lot of work that goes into folks reviewing all of the existing literature to decide where those should actually be. And we also have on this page a number of ways that people can find that information. So under the additional resources here, you can see in the purple bar, in addition to our pop-ups, we often have links to other things. So for example, airnow.gov or fire.airnow.gov, which is the EPA's new pilot map. They started it last fire season and have made some updates for this fire season that I think are actually quite nice. So if you haven't looked at it in a while, I definitely recommend checking it out. It will show you, pardon, it integrates information both from EPA regulatory monitors, as well as from low-cost sensors like purple air sensors. And it puts it all on one map. And it also has on that map, if you click on an individual sensor, it'll show you a number of different things, including things like the trend, sort of what's happening with that sensor over the last half hour. So lots of good information there. There are also, of course, maps from proprietary folks that make their own sensors. We get asked a lot about the purple air map, and so we put the information there, but noted that the data is less high quality, that it doesn't undergo the same kind of QA that the data on fire.airnow.gov does, and doesn't automatically use the best correction factor. We've also linked to a little video over here on the right where some US EPA folks made this video to show you, how to use these different tools and how you can find that information. So lots of stuff on this page about where to get that air quality information. All right, on the next page of the story, we then go into what the health effects are in kids specifically. Mark walked you through, some of the health effects overall, and that we know a lot of the folks who are already disproportionately affected by air pollution also get really hit with wildfire smoke exposures and are vulnerable to those. On this page, we talk specifically about children. As I mentioned, there's a lot of data about particulate matter effects in children, even outside wildfire times, and there's mounting evidence of similar health effects for kids during wildfire. So lots of evidence of upper respiratory effects. That includes all the things that people sort of expect with smoke, right? Itchy eyes, sore throat, cough, sneeze, runny nose, increase in colds as well, upper respiratory infections. There can also, though, be lower respiratory effects related to wildfire smoke, so worsening of asthma and wheeze, as well as respiratory infections, increased rates of things like pneumonia. Certainly this year, there have started to be some studies suggesting that there may be increased rates of COVID-19 as well related to wildfire smoke exposures. And then there are also, there's increasing evidence of other effects as well. And this is more sort of drawing on literature outside of wildfire smoke times, though I expect that the breadth of our knowledge will continue to grow. But that includes metabolic effects, things like changes in obesity or blood pressure or glucose regulation, neurocognitive effects, like effects on attention and IQ. And then of course, particulate matter is a known carcinogen, right? It increases the lifetime risk of lung cancer. And so we certainly would expect that PM 2.5 from wildfire smoke is no different there. One of the other things that is on this page that has information about pediatric health effects is a link to a presentation by Lisa Miller, who is a researcher at the National Primate Laboratory in by UC Davis. And they've done some really interesting work. They have a group of rhesus monkeys that were exposed, or rhesus macaques, I think, that were exposed to wildfire smoke as young infants. And they've been able to follow those monkeys compared to a control group that wasn't exposed, and really looked at changes in lung structure and changes in immune function that have occurred over the life course. And it's a pretty unique little cohort because they've got, very specific, detailed metrics of their exposure, and they've followed them for their whole life. So some really interesting stuff, and really powerful example of how exposures during childhood, right, during these periods of rapid growth and development, can have lifelong effects. All right, the story then moves into the sections on what can we do, how can we mitigate the effects of these wildfire smoke exposures for kids? And so one of the sections we have is about masks or respirators. And we have the whole table and a framework for how to think about masks, really with these 4 questions on the left. So when you're thinking about a mask or a respirator for a kid to try and protect from wildfire smoke, you want to think, how well does it filter, right? The material itself. Is it easy to breathe through and is safe? How tightly does it fit to my child's face, right? It doesn't matter if the material is really good at filtering. If it's this far away from my face, that makes no difference. Or even, this far with a bunch of leakage. And are these regulated so that I can safely provide guidance, for a healthcare provider, I can provide guidance to my patients that I know that there's a framework making sure that these devices, meet the requirements that we expect them to. Using that framework, we walk you through in a table in the story the fact that cloth face masks cannot be relied upon for protection from wildfire smoke. That's partially because, question number 1, how well does it filter, is a big unknown for cloth face masks, right? They're not regulated. We don't know. I like to joke that I can't walk into, my local fabric store and ask for the material that filters 90% of particles, right? There's no aisle for that fabric. And then over here on the right, we have a depiction of how effective we expect other kinds of masks to be. So medical masks or surgical masks, sort of the standard non-woven pleated mask, and then a NIOSH N95 mask or a fit-tested N95 mask, and how effective you would expect those to be. So the idea with this figure is it's showing you in unhealthy conditions, right? If we're in the red, a medical mask, which would be expected to decrease someone's exposure to particles somewhere in the ballpark of 20%. Again, that's going to be variable depending on how tightly it fits to the face, but not a huge decrease. That'll bring you either still within the unhealthy category, but lower in the unhealthy category, or maybe if you're right at the bottom of unhealthy, it could nudge you into unhealthy for sensitive groups, you or your child. A NIOSH N95 mask worn by the general public, we would not expect someone to be fit tested the way that, for example, most physicians are fit tested if they work in hospitals. So in that case, you would expect an N95 to decrease someone's exposure about 80%. There's pretty limited data. We expect that that's somewhat similar for kids and adults, especially as we're talking about older kids. School-age children often can fit small N95 respirators. My daughter, for example, can fit a small. She's 7. So that if you're in unhealthy conditions, that would bring you down into roughly the moderate range. Of course, if you've been fit tested for an N95, you're part of a respiratory protection program, we expect that decrease to be even better, and you'd be able to get down into the good range from the unhealthy range. Another graphic that we have on that as a pop-up on that same page is this one about protecting your family from wildfire smoke with masks or respirators, and it again walks through that NIOSH certified N95s are the most effective. that school-age children may well be able to fit small N95 masks, but that you want to try them out to see what fits well. Gives information about putting it on properly. Talks a bit about the medical surgical mask, that we don't expect that to be as helpful, but that you know, the better the fit to the face, the better it will be. Information about how do you, which children can use a mask safely. So that's if they're awake and over the age of 2, if they can tell you if they have problems with the mask so that it can be taken off, right? So that's sort of the safety stopgap, is you only want to be using these with children who are able to verbalize if they have an issue. If they're not going to pull on it or choke themselves with it. Of course, many of these have things that go around the neck, right? So that's crucially important. And that they're supervised by an adult. This isn't something you'd want to be leaving a child by themselves. And then we also have information about how to perform a seal check to improve the fit of a NIOSH N95 for yourself or your child, and how to check for leakage around the edges. All right, so that's our page about masks. But I would say actually more important than mask or respirator use is making sure that you have cleaner indoor air. More important because you can improve health for multiple people with one intervention, and because it's more sustainable, right? A mask is only going to be helpful while you're wearing it, and while you're wearing it in place, you know, tightly. And so if you're fidgeting and moving it around, you're going to increase your exposure. And so indoor air interventions can really be much more effective for children and for adults, frankly, as well. So when we think about indoor air, we have to think about how smoke gets into a home. There are basically 3 main ways. One is through natural ventilation. So that's if you open your windows, you open your doors, smoke comes in. That's natural ventilation. The second is through mechanical ventilation. If you're running an HVAC of some sort, right? Air conditioning, heating, you've got a fresh air intake. It can come through that way. And then there's also what's called infiltration, right? None of our buildings are shrink wrapped, absolutely sealed. And so through all of those little small openings and joints and cracks and things, smoke can infiltrate into the home. I often, you know, when I'm presenting this to folks, like to make the point that sometimes our gut reaction is like, oh, well, that's fine. Smoke's outside, we're inside. We just want to lock it down, right? Like we want to shrink wrap the house and make sure nothing can ever get in. But the problem with doing that is that actually you can then end up having problems with pollutants and moisture that's produced indoors. And so you can run yourself into other issues. So instead of thinking, okay, it's outside, I don't want it to come in as the main focus, instead what you want to think of is, okay, these are the ways it comes in from the outside. How can I make sure that all of that air, or as much of that air as possible, is being filtered? And so that's, if you look on this right-hand side in this little graphic that comes from the California Air Resources Board, they make the point here that you want to filter your air. So if you have a certified portable air cleaner, you can do that. If you have an HVAC system, like an AC or heater, you can replace the filter in that with a MERV, that's MERV, that stands for minimum efficiency rating value. MERV 13 rated filter or higher, closing your windows and doors. And then of course, if it's not possible for you to do that for your entire indoor space, this carb graphic is making the point that you can pick one space within your home to make a cleaner space that people can be in during a wildfire event. There's also some interesting sort of emerging information about do-it-yourself air filter fans. You can make one of these relatively cheaply. They can be sort of somewhere in the range of $30. And there are a number of folks that that have information about how to put these together with a box fan and a filter. One of the key things to know is that you want to make sure if you're doing this or recommending this to folks that they're using modern box fans. So those are ones built in 2012 or later. And that just has to do with sort of safety fuses that the more modern ones have to prevent fire risk. All right. So with that, in order to be able to do those kind of interventions and have a cleaner indoor air space for your family, you need to have thought of that before the fire event happens. And so that leads us right into preparedness.
Thanks. Just a few notes on preparedness. You know, in the storyline, Sofia brings up that they have a plan for emergencies, right? You know, and they do, and they've practiced it. They have an emergency kit. So what are important things? Well, first of all, only about 52% of people in the US report having made a plan for wildfires. So, if you live in an area prone to wildfires, this is really important. So one is to make sure you can get warnings and alerts through various apps. Another is to make the emergency plan itself. How are you going to communicate with friends, relatives, within the family if you get separated, if you have to evacuate, and to have a kit. So you put together whatever, a suitcase, a backpack, with emergency information, supplies, some food, water, etc. And, it's recommended that you have a kit with a 7 to 10 day supply of necessary medications, because as we experienced in my area with the campfire, it can be quite a period after, a wildfire before things are up and running. Your pharmacy, hospital, healthcare provider may be out of commission or impossible to access. Next, in the little central area, we have examples of apps that are give you emergency alerts, not just for wildfires. These include hurricanes and other natural disasters, etc., and point people to links for American Academy of Pediatrics Family Readiness Kit and checklists. This one is from Marin County in California that I personally think is really excellent. Next slide. Yeah. Just to mention that we have a recognition here that mental health support is really important after wildfires. There were studies in Canada and Australia and documenting that having lived through wildfire and associated issues, that there's a quite dramatic increase in PTSD and depression in both children and adults after these, increased use of alcohol, etc. And that what I thought was really important take home for me was that children that prior to this kind of exposure had higher self-esteem and resilience were much less impacted than children that had lower self-esteem, which points to the importance for community and school-based programs aimed at increasing resilience both before and after a wildfire, so that we can do something in preparation. Next slide. I don't know. Yeah, and we try to take all this kind of information for our healthcare providers that are using this and make it, give them a simple kind of script. So here's one example. How do I know if the air is bad to breathe? This is a kind of question that if I'm a pediatrician in my office, I would be expecting my patients to come in with. And, we walk them through that, and using this idea of just like you'd have a temperature scale with numbers that as your temperature goes up, there's more chance that you have some kind of significant illness. The same thing is as the AQI gets higher, that there's much more chance of having difficulties related to that. And there's a number of these kinds of question answers that are designed to make it an easy script for a clinician. Next.
Thanks, Mark. So we also have a section on schools and what schools can do in response to wildfire smoke. One of the things we talk about is low-cost sensor use. So I had mentioned some low-cost sensors briefly before when I was talking about the AQI information. There are a number of these on the market now. And the sort of framework that you want to think about if you're thinking about low-cost sensors, if you as a clinician get pulled in to advise a local school district, for example, You want to think about how well do the particle measurements actually go up and down as the concentration increases and decreases, right? Basically, how well does this low-cost sensor track with gold standard instruments? And then is there a well-validated conversion factor to convert those particle counts into concentrations? The schematic on the right is to point out that even though our regulatory monitors use mass, they're actually looking at mass of particles. Low-cost sensors, by and large, and I'm making a bit of a generalization here, but by and large are particle counters. So there will be some sort of light source with a sensor. You can see in this image, we've got a laser on one side, a sensor on the other. We've got airflow coming through. And what the sensor is picking up is literally just interruptions in that laser. So it's counting the particles. In order to turn that into a mass, like the regulatory equipment uses, you need to know or have some sense of how much these individual particles weigh. You need some kind of conversion factor. And so every low-cost sensor is doing that behind the scenes, whether you realize it or not. And so the question is, how good is that conversion factor? And for some of them, the built-in conversion factors can be quite problematic, particularly at the high end. And so you want to, if you're advising someone on the use of a low-cost sensor, you want to make sure that there's not only the fact that it tracks nicely, but that it can be relatively accurately converted into a mass to be compared to AQI values. On the bottom left here, I've put the logo of AQ-SPEC. That's the Air Quality Sensor Performance Evaluation Center. That's run by the South Coast Air Management District down in Southern California. And they actually do third-party evaluations of these low-cost sensors and publish their results on their webpage. So if you ever get a question about a specific sensor, you can look and see if they've done an evaluation yet. They'll give information about the first question that we have there, sort of how well things track, giving that as an R-squared value. If you remember back to basic statistics, you're looking at sort of how well a change in one variable predicts the change in the other variable. That's your R-squared value. And so an R-squared closer to 1 means that it performs better. All right, we also then have a couple things to just give overall sense of what the different ways that you can reduce wildfire exposure for kids are as we wrap up the chapter. This is one of our infographics that some of you may have seen before. We have it on our Western States PEHSU page, that you can reduce wildfire smoke exposure for kids by going somewhere without smoke, by filtering your air, right? Either using HVAC and a MERV 13 filter or a portable HEPA cleaner. You can also get some decrease by going inside and shutting the windows. Of course, that varies a lot depending on what your infiltration for your specific building is. And then for short periods of time, by recirculating the air in your car, you can get a substantial decrease. That, of course, is more or less depending on how good the filters in your car are. And then wearing a small size NIOSH N95 mask or wearing a medical mask, you can get some decreases. But again, we would want these to be for shorter periods of time. As I mentioned, cloth face coverings like those for COVID cannot be relied upon to filter out small smoke particles. And then just before the chapter wraps up, we have some info on policies. Back to you, Mark.
Yeah, kind of divide this into 3 sections. One about greenhouse gas emissions and climate change in general. I point to 2 things that I think are indicate the kind of way we're going with this. One is the American Academy of Pediatrics policy statement on global climate change and children's health, and also an additional piece that they have how climate change affects children. So then we have a section on health and infrastructure assessment and response, what policies we are helpful in that regard. I think one point I would make here is that we believe that schools should become clean air shelters. So that's good for the kids that are there. It's also a resource to the community. So we need to provide funding, and there is quite a bit coming from the feds as part of the COVID response, really, but it needs to be used appropriately and efficiently in a way that improves both the infrastructure and the ability to maintain that infrastructure. And then we have some a section on forest management, and I'll highlight the prescribed burns and also cultural burns. And here's a poster that's from USDA and the Pacific Northwest Research Station, and it shows here's an area at the bottom of the image that's been not treated with prescribed burn, and the top part which was, and this is after a wildfire, and you see the significant protective effect of the burn. And one last thing to mention is, we have videos in various other places. Here we have a link to a National Public Radio piece that's 4 minutes long, and California looks to what tribes have known all along is the title of this piece. It's really a good short synopsis of this issue. Yeah, thanks.
Thanks, Mark. All right, so just before we finish, we thought we would point out to you where you can find things on our Western States PSU page, and then we'll be happy to take questions in a moment. So on our page with the Story of Health chapters, we've got a QR code there. So if any of you are dying right now to jump there, you can feel free to scan that. But this shows all 6 of our chapters that we currently have available, including the Sofia chapter that we've just told you all about. And then we've also got a page that has our wildfire material. In addition to having a link back to Sofia's story as well, we've also got infographics about wildfire smoke. Some of the things that you saw embedded in the story, as well as some others, all available on that page. So if you're interested in wildfire smoke resources, feel free to check that out as well.
Okay. Thank you, Stephanie and Mark. That was very, very informative. We're now going to open up for questions. Anybody has a question, feel free to put it in the Q&A section. We'll wait a couple of minutes to see on that, but I had a couple of questions that I thought of when you were both speaking. This one probably is for Stephanie. So the AQI sensors, they're distributed around a state. And what if you're in an area that may be 100 miles away from where the closest sensor is? What's the best way to determine what your local conditions are? Is there a way?
So really good question. Right, the regulatory monitors are often in cities, right? And so particularly in rural areas, there's less density of those. One option is to use some of these lower cost sensors. These are ones that individuals can buy, but I would say that even that, the density of those is less in rural areas or in smaller cities, right? So there are a lot more of those low cost sensors near where I live in the Bay Area than even near where Mark lives in Chico. So one option is to use those. But the other is to talk to your local air district. So everybody should have someone that's giving local information. So I know here in California, those are local air districts. So I'm in the Bay Area Air Quality Management District. And those local air districts often give information about how best to assess the local air conditions. If there's not monitoring in your area, A, it's possible they have some sort of monitoring and that they're giving out information. But B, when there's not, they often have information on sort of how to assess visibility in your area and those kinds of things. So if you don't know, who the local air monitoring person or organization is in your area, it would be a good thing for you to know, to be able to, make decisions for yourself and your family, but also to be able to provide that information to patients that you might care for.
Great. Okay, thank you. So we have a few questions and also some kudos, thanking you both for your amazing work. But here's a question from Sky. It's actually a multiple part question, but I'm going to focus on the pregnancy issue. So she says, do we know enough about smoke impact on maternal health and fetal and newborn health? What are the best practices if you're pregnant, and how well are those known? And then she had a second question about which states and tribes are doing the best job at protecting pregnant people. So I don't know who wants to take that.
Well, so the first part, do we know enough? The answer is never, right? We never know enough, but we are starting to learn some, and certainly we know that there are fetal effects when a pregnant person is exposed to smoke. As Mark mentioned, there's some data on birth weight, that there's an association with lower birth weight and with preterm birth in association with smoke exposure. We also know that we would expect pregnant people to have a higher risk based on being sort of at a higher metabolic state, right? Similar to children, pregnant people actually breathe more air relative to their size than other adults do. But definitely, you know, there's a lot of need for more research there. But you know, what we do know so far, we do expect that pregnant people are particularly at risk, and that we should try and mitigate exposures for those people. The ways to mitigate exposures are the same as what you would do for kids, right? The indoor air interventions that I talked about also are going to protect that pregnant person in your life. The question about masks and respirators, the data that we have so far suggests that those are also safe for pregnant people. But again, the stopgap is if the pregnant person feels uncomfortable, they should get to a cleaner indoor air space and take the mask or respirator off, right? That's your sort of safety stopgap. Mark, anything you wanted to add to that?
Yeah, I think we expect a lot of new studies to be published in the near term, next few years, since work on this really and funding for it has really just been over the last few years. So we will know a lot more. And I think, just as Stephanie said, in general, as far as what tribes and states are doing the best job, it's who has a good program, in general, for outreach, support, addressing environmental justice communities. Tribes often do have far worse exposures based on where they are in, often in rural forested areas that put them close by to wildfire smoke.
Okay, thanks. So there's a couple of related questions. One from Ted: since low birth weight and preterm birth are associated with exposure to wildfire smoke, any thoughts about how we could provide indoor air filtration for women who are pregnant but unable to afford indoor air cleaners? And is that maybe an opportunity for a public health intervention?
Yeah, I think it definitely is, Ted. There's, I know in my area, in the Bay Area, the Bay Area Air Quality Management District right now has a program to distribute air filters for, I believe it's kids with asthma who are on Medi-Cal, Medi-Cal being the California version of Medicaid. So those sorts of programs do exist. I don't know of any right now that are specifically distributing them for pregnant people, but certainly would potentially be another particularly at-risk population. It's also part of the reason that folks have increasingly been interested in those lower cost DIY air filters. The commercial portable air cleaner products are often in the range of $100 to $200. That can be pretty cost prohibitive for folks. Whereas these DIY ones are more, $30, $40. That's still not nothing, right? So definitely, I think there's the potential for groups to do distributions of air filters to improve folks' health.
Okay, so here's another one sort of related to reproductive health. Any links found between wildfires and infertility / the need for IVF? Anybody?
I don't know of any yet. So as we sort of hinted at earlier, this is an emerging literature, right? As wildfires have been increasing over the last 20 years, or really the size of wildfires, so the number of people who are exposed to wildfire smoke has increased a lot over the last 20 years or so, we're having more and more research coming out. So I don't yet know of any studies that have found any links there. It's not impossible that that could exist, but I don't know of any yet. Mark?
Well, yeah, I'm not aware of specifically, you know, in all of these things, we do try to make a connection between what's known from general air pollution studies. And I'm not, maybe Stephanie, you know more about that.
I don't know about the infertility literature specifically. I actually wonder if maybe Ted knows any there. Feel free to jump in the comments if you do, Ted, but I don't know of any just general air pollution. I can certainly look it up and see what I find.
You know, the other point I'd like to make related to what Stephanie was saying, well, you know, this is relatively new, that we're having this degree of exposure to wildfire smoke. It's not just the degree, it's the length of time, you know, the percentage of the year, the number of high intensity wildfire smoke days that we have, that has really dramatically increased in many areas. And so the opportunity to study that and its impacts on all types of health is a relatively new thing. If we didn't show it, but we have figures that show the increase in large wildfires, you know, over the last I don't know, decades, and in California in particular, it's really dramatically increased.
Okay, here's one from Zach. I'm not exactly sure what he's asking, but
I know what he's asking.
Oh, do you? Okay, maybe you can. So the question is, personal experience indicates that the Air Now map says it's safe when smoke is visible and the poor air quality can be felt. Any thoughts on why this might be?
Sure. So one of the questions we get a lot is people will say, well, right now the Air Now map says that my air quality is fine, but purple air says it's red or purple. Does that mean I can't trust Air Now? Right? That's a question I get a lot, actually.
Okay.
So the reason that those things are often different is because they're presenting information in different ways. So let me break down a little bit how they're presenting information, why those decisions were made, and sort of how's the best way to utilize that for yourself. So the Air Now maps are using both, and I said maps, but I mean the main Air Now page as well as the fire and smoke map, are using EPA's what they call the nowcast method. So nearly all of the literature that we have for air pollution health effects is based on daily averages. There's starting to be some with shorter term averages, but the bulk of it is based on daily averages. So the information that we have for health effects is related to daily averages. That makes it hard to create these messages for shorter time periods. But what the EPA has done is they've said, you know, we recognize that there are times at which air quality can be changing rapidly, wildfire smoke events being a great example of those. And so when that's happening, they use what they call their nowcast method. And that's an averaging technique. We don't need to get into the nitty-gritty details, but that basically does exposure over a few hours instead of over the course of a whole day. So when things are changing rapidly, the information that's presented on Air Now or Fire and Smoke Map will be roughly a 3-hour average. So an average of what's been happening in the last 3 hours. And as I said, the scientific underpinning for that is that getting much shorter than that, we just really don't have the science to back that up, right? It's hard to say what exactly a health effect is of a 10-minute or a 1-hour exposure because we don't have that kind of data. Even 3 hours is sort of extrapolating shorter than much of the literature that we have. But the EPA has added to their fire and smoke map a trend that shows you what's happening within the last half hour. And so what I recommend for folks, if you're trying to use the Air Now fire and smoke map to make kind of minute-to-minute decisions, like when today do I take my kid to the park? When do I go out for my run? That you can look at those averages over the last few hours, but also look at that trend information, right? Is it getting better? Is it getting worse? Is it staying the same? The Air Now information also, when they use the low-cost sensor data, has a built-in, best practices correction factor, and also applies the nowcast method to those. A map like Purple Air, for example, and I'm not picking on them per se, it's a very popular one, so we get asked a lot about it. They use their own correction factor, which is less accurate. You can select the US EPA correction factor on that map. So certainly if you're using that map, you should do that. But the longest averaging time they have is an hour. The problem with that is, in addition to the sort of lack of health data I mentioned a minute ago, you can also have fluctuations in that data that are not due to local area effects. So for example, if I have a purple air sensor right outside my home and a UPS delivery truck sits there and idles for 5 or 10 minutes, that's actually going to drive my sensor value up. That's a real thing that it's measuring, but that doesn't necessarily reflect what's going on in the local area. And so someone that's trying to use my sensor to get a sense of their exposure would be misled by that. So for a number of reasons, it makes sense to use a slightly longer average, but I do recommend looking at that trend value on the fire.airnow.gov map, which is a new feature. So my hope is that if we can get more and more folks using that, that will help folks to feel more confident in what they're seeing there. But it's tough, these questions get tough because it's complicated stuff, right? Exactly how the information is being presented. Feel free to ask a follow-up if that didn't answer all of what you were hoping to hear, Zach.
Okay. It looks like most of the questions have been answered. There was one asking for you all to share information for a webinar that's being organized in the Central Valley for unsheltered and migrant farm worker population. So Mark wrote back and said you'd be happy to talk with them, maybe set up a call on that. Let's see if there's anything else here. Okay, Zach says thank you for that answer. Stephanie.
You're welcome, Zach. As I said, it's complex, which it makes it tough, right? And it's especially hard when you're trying to give information for folks that may not be particularly scientifically savvy, right? To help folks understand why they're getting different information from different sources. It's challenging.
Yeah.
Yeah, we've been thinking about making a fact sheet to walk people through that set of information and how to use those. I think something like that's really needed.
Yeah, would you all find that useful? Anybody want to? Well, I think we already got the answer from Zach that it would be useful. I just had a final question. You talked about the N95s quite a bit, Stephanie. In the beginning of COVID, of course, everybody was told not to buy them, save them for healthcare providers. Are they now pretty much available to anybody that needs them or wants them? And are they making them for kids at this point?
Really good question, Maria. So they are widely available now. They are no longer being prioritized for healthcare providers, so you can go out and buy them. Certainly local stock of things is always variable, but I know for myself, I was able to find some on Amazon, not to endorse specific things, but you can find things available on the internet if you need them. You certainly want to make sure that you're getting NIOSH certified N95s. Because that's how you know that that they are meeting the standards that they purport to meet. No, sorry, you asked a multi-part question. And then no, currently in this country, there are not N95s specifically marketed for children. There are similar kinds of masks in other countries that are intended for children. But one of the issues is that things that are coming in from other countries are of pretty inconsistent quality. And so early in the pandemic, NIOSH, that's the National Institute for Occupational Safety and Health, did some testing of the various kinds of masks and respirators coming in from elsewhere, things like KN95s, KF94s, all of these others that folks now know the names of. And the problem was it was pretty inconsistent whether those were meeting the standards that they purport to meet. So if you want to make sure that you're buying a product that will protect you or your child well, I would stick with a NIOSH certified N95. As I mentioned, no, there aren't ones specifically made for children right now, but many school-age children can fit small adult size N95s. So I mentioned my 7-year-old daughter wears an N95 that's a small adult one, and it fits her very well. It took me trying out a couple different brands to find one that fit her well. That's not ideal, right? But it is possible.
Yes.
That's,
So
that's really that's really an important point. You know, it may be it's small, medium, large, or whatever. These are designed differently by different companies, or even the same company has different fitting things. And it's really
That's right. There's no standardization.
Yeah, it's really important to just try them and see how they fit, how comfortable they are. It's good because the child gets a chance to acclimate to the concept and wearing it, and then you can do a seal test and see how does it seem to be functioning well.
I know we're at the top of the hour, but I just wanted to get this last question in from Vicki. So she's kind of goes back to what you were just talking about, Stephanie. She says, what about the KF94 masks that are vetted by the Korean government? I mean, a lot of people were buying those. I've bought them thinking if I can't get the 95s, I'll get the KF94. But basically, you and Mark both just said that there's really no quality control on those, and they could be, there could be a wide variance. So
right, there can be quite wide variance. And so if you want to know that you're getting something that's going to protect, you, yourself, your children best, you want to make sure that you're doing a NIOSH certified N95. And the reason I keep actually specifically saying that is that N95 is also not a protected term, right? So I could make something in my backyard and call it an N95. That doesn't mean that it meets that same protection level. So it has to be NIOSH certified N95s. You cannot rely on the KF94s. In theory, the standard that the KF94s are supposed to meet is very similar to the NIOSH certification process for N95s. But as I said, when testing was done on those coming into this country earlier in the pandemic, it was pretty clear that many were not meeting the standards that they purport to meet.
are any of the 94s NIOSH certified?
No.
You know, they're not.
No.
Okay. Okay, well, Hannah, I think we're out of time.
Yeah, great. Thank you so much, Stephanie and Mark and Maria. We're approaching the end of today's webinar. A video recording will be available on CHE's website soon, and tomorrow you'll receive an email containing a link to the video. The next CHE EDC partnership call will take place September 22nd and is titled Multi and Transgenerational Outcomes of an Exposure to a Mixture of EDCs or Endocrine Disrupting Chemicals on Puberty and Maternal Behavior in Female Rats. To learn more and RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these CHE partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Holm and Dr. Miller, for taking time to present today, and to you, Maria, for your excellent moderation. Thank you so much for joining us. Wishing everyone much health and wellness. Take care and have a great day.